Hello. So to introduce ourselves, my name is Sarah Bayoumi, and my role in Lend is as a neurodivergent cell.
And my name is Hala, and I'm in the human development discipline, and I'm also a graduate student doing human development right now, and I'm a family member of some cousins with autism. And we're really excited to talk to you all today about our project looking at the role of religion and service access for Muslim parents of autistic children. And these are our disclaimers.
So we first want to introduce you to Muhammad. And a little bit about him is that he enjoys going on car rides with his parents, who are both immigrants from Lebanon. He also loves going to the park. And he was diagnosed with autism when he was 6 years old. Now, this is a little bit later than the average age of diagnosis in the US, which is around the age of 4. So we want to take some time to think about some factors that may have influenced him getting a slightly later diagnosis. So at an immediate level, we have his parents, providers, and his imam or his religious leader. Now looking further out, we also have the service system that may be impacting his ability to get a diagnosis, as well as the school and his mosque.
And when you zoom out even a little bit further, you can see that there are ideologies or organizational factors at play that can influence his development. For example, public policy, systemic racism or Islamophobia, as well as his family's religious values. And all of these systems are constantly interacting with one another and creating a combined effect on Muhammad's experience throughout his entire development. But very rarely have we looked at how religion, specifically religious values, religious leaders, or places of worship can influence development despite the role that religion can have in our lives. So from trying to understand the disparities, we know that there are disparities in the literature according to race, ethnicity, socioeconomic status, but very rarely do we understand how those disparities look across different religious groups. And part of that could be due to the fact that data are very rarely collected according to religious affiliation. Furthermore, many Muslim parents identify as North African and Middle Eastern, but historically in the US, those families have been categorized as white. So overall, there are many barriers to understanding Muslim parents' experiences here in the United States. And lastly, studies that do look at faith and autism may focus on other groups such as Christianity or Catholicism instead of Islam and Muslims.
So connecting this back to our example, in most studies, Muhammad, his religion would be unknown since data is rarely collected about this, and his race would be classified as white even though he's Middle Eastern. So although Muhammad's family may be experiencing intersectional disadvantages of Islamophobia and racism on top of ableism, their experiences wouldn't be accurately captured by the way the data is often collected.
Now, based on the current literature, we found outside of the US, some Muslim parents will attribute religious beliefs to what they believe to be the cause of autism. They might seek out spiritual interventions for their children. In the US, there was a study looking at South Asian Muslim families in which their elders in the family would actually encourage parents to go seek out religious interventions for their children. But most of this literature has been done with very small sample sizes and has been mostly done outside of the United States. So we don't really understand the American Muslim experience quite yet. And furthermore, this was inspired by a conversation with some community partners at Opening Doors who brought to my attention a couple years ago that here in the Sacramento area, with the Muslim population they work with, many parents might associate religious beliefs with the cause of autism. So that's kind of what opened the door for us to go down this research.
So this brings us to the focus of our Lend project, which was to understand the experiences of Muslim parents of autistic children in their religious community. So regardless of whether you are an advocate or a researcher or a clinician, we hope that our project, through presenting these findings, that you'll better understand the needs of the Muslim autism community, as well as consider the role of religion and religious communities in your clinical work.
So we conducted interviews with Muslim parents of autistic children here in the US. We recruited from parents who previously completed a survey online. All of our interviews were done over Zoom, and we have 6 currently done and coded to share with you today.
So to analyze the data, we used rapid assessment coding by developing the code book, and then we coded the data into different categories. And then to make sure that we were coding this data consistently, we selected half of the interviews to double code and compare each other.
So the themes we'll be talking about today include religious community, participation in religious activities, self-identity, and recommendations for change in the Muslim community.
The first theme was religious community. So parents shared that autism is misunderstood and rarely spoken about in their communities. And unfortunately, they felt unwelcomed, ashamed, and even isolated from their community. Parents also shared with us that they did not seek support from their imam when they started noticing developmental concerns with their child, even though they were going to their imam with other personal concerns as well as religious concerns. And this was due to either not considering it or due to stigma. Parents also told us about the Muhsin Masjid certification program, which allowed education for their mosques for some that helped to improve attitudes within the community, as well as helped parents find connections with other families.
So our next theme looked at participation in religious activities. Now, unfortunately, many parents reported experiencing some type of judgment in their community, whether that was hurtful comments, receiving bad looks, or being outwardly told to not bring their child back to the mosque again. And as a result, some parents became less active and less involved in their mosque due to the stigma. But there was also a lot of accessibility issues. For example, parents often reported struggling to find respite care. Without respite care, they couldn't come to the mosque and participate in events as much as they'd like to. Most parents did report attempting some type of religious intervention for their children. So this came in the form of Quranic recitation or the use of holy water, but there were varied developmental outcomes in terms of how they saw their child's development after those interventions. And lastly, some parents described accommodations that made it easier for their child to participate in the community, even if those accommodations weren't necessarily intentional. For example, some parents were able to watch the sermons on live stream from home. And one mom spoke about how when there was a festival in the community, she was able to get a wristband so her and her son could advance to the front of the line and not have to deal with the challenge of waiting in line.
Our next theme was self-identity. So parents described their religion helped them find a new sense of purpose in life after their child's diagnosis, and that for some, religion helped to reframe autism in a more positive light by seeing it as a gift or a blessing. Some parents also shared that they noticed personal growth, such as becoming more resilient and patient after having a child with autism. And some shared that religion played a role in helping them towards that journey.
Now, lastly, we did ask parents about what would be helpful in the community. And there were quite a few recommendations we came up with. The first was to educate various different community members about autism and other developmental differences, and eventually have this education be led by the religious leader at the mosque. And so this could come in the form of sermons about disability led by the religious leader. Many parents also advocated for adapting religious educational programs such as Sunday school for autistic individuals and to be inclusive of different learning styles. Furthermore, parents wanted to see more respite programs developed at the mosque and within their community so that they could have more opportunities to participate in their community events. On that same note, though, parents would really like for those community volunteers to actually receive training in how to work with autistic individuals so that they can feel more at ease with who they're leaving their children with for some time. Parents also wanted to see more accessibility at community events. So the example of having a wristband to be able to take your child to the front of the line. And lastly, there was a really big push for having spaces for parents of autistic children in the community to connect with one another. So in conclusion, although Muslim parents have reported, unfortunately, experiencing some sort of stigma or judgment in their religious communities, there are amazing programs out there like Muhsin that have made it to help educate their communities and make parents feel a little bit more connected with one another. And lastly, while Muslim parents may not necessarily be going to their religious leaders to understand their child's development or the service systems here in the US, it does seem that they are going to them for some sort of religious support.
So for our takeaways, it's important to note that as parents described to us, religion itself is not the reason for stigma in their religious communities. And if anything, religion is a positive support by seeing autism in a more positive light. And it's possible that for families like Mohammed's, religion may play an important role in the journey towards accepting and understanding their child's autism. Now, when we came into this project, we were interested in whether educating parents or religious leaders would be helpful for improving access to diagnosis and services for families. But as we spoke with parents, we found that their top priorities were really focused on belonging, education, and accessibility. So it's possible that programs and interventions focusing on this may also have benefits towards accessing services.
And we just want to give a big thank you to Yui, also Avin. Both of you have been really supportive in putting this project together. And of course, a huge thank you to all the parents who trusted us and shared their stories with us to make this possible. And also, we just wanted to throw up the information up here for Muhsin and Opening Doors in case you're ever working with Muslim clients that you would like to refer them to these.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.